Hi, everyone. Thank you for being here. We're Impactpharm. We aim to prevent drug-related emergency room visits. My name is Sophie. I'm a pharmacist, co-founder and CEO of Impactpharm. Currently serve as a pharmacy preceptor at a free clinic in downtown Minneapolis. Over the past year, I was able to bring on board experts in strategy, finance, IT, and healthcare. As a frontline pharmacist, I have to identify the core problem. Many patients, especially cancer patients, have multiple medications and experience information overload during regular visits. 40 to 80% of information provided by healthcare practitioners is forgotten immediately. Many of our patients are unable to think of any question on the spot until it's time to take their medications, but few have support outside the business hour. To tackle this problem, we provide our solution of an on-demand marketplace app where each patient can choose a pharmacist to be by their side as a health coach. And this intervention can improve patients' medication experience and outcomes. It's important that we work on this problem. In 2002, 28% of all ER visits were drug-related, and 70% of these visits were preventable, which with the pandemic, you could imagine it has gotten worse. In 2019, unaddressed drug-related questions caused 6 million preventable hospitalizations and over $9 billion in incurred costs. By going above and beyond to help 1% of cancer patients with complicated medications, we can save the healthcare system at least $2.4 billion. We are validating the outcomes of our solution. We would love to partner with the Mayo Clinic and federally qualified health centers in Minnesota to advance patient care, research, and education together and explore more use cases for the Impactpharm app and the framework that we bring forward. Thank you for listening to this pitch, and we'll love to have your feedback.
Hi, Sophie. Would this service be covered by insurance, for instance? Because that is a big issue when we're dealing with, consultations and management of therapies.
Yes, absolutely. Currently, the way that pharmacists' consultation services are being billed is that MTM services. However, most of these services are over the phone and during business hour, and I would like to extend that to 24/7 services.
Sophie, with any software application, the MVP is pretty critical, because you could go big or you could keep it really small. What are the couple critical things that you think are most important for your application?
Yes, so our MVP is currently patent pending and is available on both the Android and iOS app stores. So that has been most of the work that we have been working on since February until early August this year, and we have been able to complete that step. And now is the step where we can validate it with a larger group of patients.
So, I understand like consultation, initial consultations get billed and can be, insurance can pay for that, but sometimes subsequent follow-ups and things like that are not. I know some places like Cleveland Clinic are charging patients now for Epic in-basket messages. Are patients going to be paying out of pocket for talking to their pharmacists, and how are the pharmacists going to get reimbursed?
Yes, in the long term, we want this to be more a subscription service rather than like a usage-based charge system. So this is where we happen to be also in the managed care land. Minnesota is where 3 of the biggest insurance companies here in the US are, and with this study that we are proposing, we're also working with these insurers to make sure that we have a reasonable payment system for the patients as well as the pharmacists and other healthcare providers involved in this process.
How do you plan to recruit and keep pharmacists in your network?
That's an excellent question. I have been able to reach out to pharmacists throughout the country through my LinkedIn network. And I also have a survey that I started back in February. Within my network, over 2 days, I have over 500 positive indication from pharmacists that this is something they would like to get involved with.